Hello, hi, my name is Dan Austin. I'm a nurse here at the High Desert Heart Institute, clinical coordinator for the Congestive Heart Failure and Pulmonary Hypertension Clinic. Today I have with me a gentleman here, a special gentleman. His name is Ilya Pupovac. And Ilya was one of our original patients in our study back in 2009 for our clinical trial on our L-arginine complexer. It's how it would affect patients with a multitude of different disease processes. We had taken 35 patients for our clinical study. We had different subsets of those patients. Dr. Siva has talked to you about the different subsets of patients. We had patients with malignant hypertension, which means that they were on 3 to 4 different blood pressure medications and they were not having control of their blood pressure. We had patients with severe coronary artery disease, peripheral vascular disease, peripheral arterial disease, and some of these patients were also had diabetes with small vessel disease. Some patients who had chronic angina, and for these patients who were having chronic angina, there was a special type of treatment called EECP, external enhanced counterpulsation. And the room we're in right now is a room that I met Ilya. Ilya was referred for EECP after he had, Dr. Siva had put a stent in him. Ilya, can you tell me how old you are?
I'm 79 and a half.
79 and a half. 79 and a half, going to be 80 next July? Next July, okay. So when I first met Ilya, Dr. Siva, I think I met him in this room. I think we met in this room, did we not?
Correct.
We met in this room. And we had just started, Dr. Siva and I had just started the study. And he had a history of having a stroke. He had a history of high blood pressure. He had a stroke back in 2005.
2005, May the 10th, 05.
So he remembers that. We remember the day we have these acute processes that change our lives. And so it's interesting to remember those days. But he had a stroke. He had a history of coronary artery disease. Dr. Siva had placed a stent in him, and he had sent him up. He was having chronic chest pain, or we call angina. Dr. Siva had sent him over here to EECP to start EECP, which is a mechanism, a treatment to reduce incidence and episodes of angina, whether it be with exertion or whether it be just at rest. So with his history of coronary artery disease, hypertension, history of a cerebral vascular accident, or CVA as we call it, Dr. Siva felt that it would not only be good for the coronary arteries, we call macrovascular processes, but also to improve microvascular access also too. So Dr. Siva feels that this would be, because of our history and our success with EECP, what we have done is we've taken patients and put them on a nutritional supplement called Arginetix. And this is a nitric oxide formula that has a vasodilatory effect. And we have our patients take this 30 to 45 minutes before they come into EECP. So before I go on and tell you a little bit about, I'm very fortunate to have, I called Ilya up because Ilya, we see each other about every 2 months when he comes in and picks up more Arginetix. But being in with one of the first people in our clinical trial, Dr. Siva said, I think I want to pull Ilya from EECP, okay, and bring him over to the study. Because I think that with his history of coronary artery disease, his history of AFib, also I added AFib in there, his history of hypertension, I think he'd be a person who would benefit from this tremendously. This procedure, EECP, patients come in, they lay on this table here. We wrap these around their calves, their thighs, and then their lower abdomen. They lay on the table, we hook them up to a cardiac monitor, and then when the monitor beats, these compress and squeeze, and what it actually does is it produces nitric oxide. This machine actually produces nitric oxide. Dr. Siva was the first cardiologist to present this to our patients in the high desert over 20 years ago, and it's an interesting process because patients will be here on this table for 1 hour a day, 5 days a week for 7 weeks, and it has tremendous success. What we've been able to do now, we've been able to potentiate the success by introducing and giving these patients this nutritional supplement. So what happened was, Ilya, when we did our study 10 years ago, Ilya completed the study and then came back to me, and we were reviewing his previous labs and then his labs afterwards. I have him on video, and the purpose today basically was to see how where Ilya is 10 years later. Okay, Ilya is a man of few words. Okay, so he's always been a man of few words, but one of the things that he has been most grateful in telling me is that this nutritional supplement has been something that has been a life-changing nutritional supplement for him, and that he would not be around today. I think that would not be around today if it wasn't for this. And what it's allowed him to do, it's allowed him to do certain physical exercises continuously. How many days a week?
7 days a week.
7 days a week. So when we put this together, we're going to put this video with our other YouTube video. We're going to put them together, and you're going to see where Ilya was 10 years ago, and then where Ilya is today, 10 years later, still using this nutritional product. Okay, going through. So we have a 79-and-a-half-year-old gentleman here right now. Can you tell me, were there any changes made in the exercise regimen that we talked about on the previous video? Do you recall the changes, or can you tell me what kind of exercise regimen you do right now?
Oh, I do. I do usually at home. I can go to the physical exercise. The Medicare pays for it, but you get in the car, you got to drive it, you come back, and this, that. So I decided to do it at home.
Yep.
I'm fortunate to have a home, large home in a living room, family room. Kitchen is all, accessible. So I go roughly 45 steps, optical circle.
Okay.
And I do that, then so much of that, and the squat up and down, so much of that. And I do the push-ups. And I also lie on my back and do the torso.
How many push-ups were you doing? How many push-ups were you doing?
I do 10 at a time, roughly 40 every day.
40 every day? Okay. And then there was also a thing you were doing on a previous video. You were doing some squat. There was a squat.
Squatting up and down. I do 25 of those.
Is there anything you want to?
Up and down is 1, so 25. It's up and down. It's 50, 25.
Okay. Is there anything you want to show me today, as far as some of the things you're showing? I know you didn't bring your tennis shoes, but the thing is there anything you want to show us today, as far as some of the things that are in your daily regimen, as far as exercise?
If I can show
you. Surely.
I mean, this is. Probably the public would know what I'm doing. I think I'm not playing with a full deck, but
I've done that for a long time, Ilya.
I don't know if it's any good or not, but anyway, what I do is I go.
Okay.
I do 25 of these.
Okay, I think
down and up it's 1.
Okay. So the thing is, and one of the ones to notice about that right there is that we talk about from the nursing standpoint, okay, healthcare standpoint, we talk about the avoidance, okay, or prevention of falls. Okay, fall risks, okay, in the older patient population, okay, they'll have a higher incidence of hip fractures, okay, or other fractures of the lower extremities. So one of the things you may have noticed with Ilya there has been his balance. And so with other ingredients on this action we have with the Arginetix, with our vitamin D and other ingredients, the antioxidants that we have in our product is really giving him more energy, okay, to be able to continue to do this on a daily basis on this aspect, continue that, and have his recovery better. These are things that he's described to me in the past. So when you take a person who's 79 years of age and able to do those squats, okay, and have maintained that balance without the fall risk, that's something I think is very important for an older patient population to think about. Okay.
I never had any fall. I had a good balance, So the Argin, that help gives me the energy to what I'm doing every day. I start 7 days a week and 45 minutes to 50 minutes to
okay.
To see.
Okay. One of the things also too. One of the things that Dr. Steve and I, when we were formulating this product, we put in 9 grams of branched chain amino acids, okay? And what those are building blocks for protein. As we age, okay, we start losing lean muscle mass. So the importance of being able to maintain lean muscle mass for someone who wishes to exercise on a daily basis or almost on a daily basis is really important. And so if you look at Ilya's body habitus, okay, you're looking at someone who is 79 years of age, but he doesn't have that sagging aspect going through, okay, maintaining good biceps at this aspect for a 79-year-old and that part of it there going through. Maintaining lean muscle mass is really important, and having 9 grams of branched chain amino acids as you're building blocks of protein is one of our key ingredients on this process right here going through.
I strongly recommend it.
Okay, going through. So you're doing your jogs around the house. You're doing your squats. You're doing your push-ups. Okay. Any other aspect you have in your daily
I lay
regimen?
on my back and lock my feet with the coffee table, and I do the lift and torso up and down about 40 times.
So sit-ups on that aspect of it going through. Okay. So what we'll do is we'll follow up then with your other vital signs and your lab results, because it's truly been an honor to be able to see you continue to do the things that you love to do 10 years later after we've introduced Arginetix.
And that was
Arginetix.
05, so now I got 19, almost 20. So it's 15 years. Oh, no, 10 years. I'm sorry. 10, you're right.
10 years for that part of it there,
Yeah.
but the thing is going through. But it's the aspect of it is that you make my job, you make what I do more rewarding, Ilya. Okay, because you walk the walk. You don't just talk the talk, and this is what we talk about there.
Yeah, I mean, it's you've been. I mean, you saved me,
No.
Dr. Siva and RG9 together. I mean,
Good.
and I'm back a lot again,
Thanks so much, Ilya.
Thank you very
Appreciate
much, then.